involving e-patient. E-patient term has the origin before the advent of the internet. It was coined in 1975 by a doctor to prescribe a patient who's equipped, enabled, empowered, and engaged. A number of various factors came together to make the e-patient movement, including access to the internet, simplifying search capability, policy initiatives, passages of legislation, and healthcare reform, ensuring that patient-centered care and comparative effectiveness has research backing the information. People who are looking for healthcare information online were characterized by their health status. The physically fit, well, newly diagnosed, and the chronically ill, as well as caregivers, often exhibit information-seeking behaviors based on the health state. Contemporary e-patients continue to be characterized by health status. Activist e-patients are increasingly invited to participate in conferences that target health professionals. The e-patient today is characterized as an individual that uses technology to actively assist in their own health care and manages their responsibility of their own care and wellness. These individuals are enabled digitally, they're seeking information, they're sharing knowledge, and they connect with others. Many e-patients will manage their health decisions daily and use the internet to supplement their health journey. It is an individual's conscious decision not to use the internet. The digital divide will continue to narrow as technology companies expand free and low-cost broadband access to those traditionally underserved individuals. Patients are included as integral members of the healthcare team, and today's technology is highlighted as a critical component for improving safety and quality healthcare. Beyond patient visits, the individual will have the care they need when they need it, whenever they need it. They will be able to find assistance in many forms, and they can find help on the internet, telephone, or various sources. Individualization for an individual, they will be respected for their individual thoughts, choices, and preferences. For control, the healthcare system will take control only and when the individual provides permission. For information, the individual can know what they want to know when they want to know it. The medical record for them is theirs to keep, read, and to understand. The rule of thought is nothing about you without you. For science, the individual will have care based on the best available scientific knowledge. The system promises excellence as a standard. For safety, errors in care will not harm an individual. The individual will be safe in the healthcare system. Transparency. An individual's healthcare will remain confidential, but the healthcare system will not keep secrets from the individual. Anticipation. The care that is provided will anticipate an individual's needs and will help the individual find the help that is necessary. For value, the healthcare system will not waste an individual's time or money. An individual will benefit from constant innovations. Cooperation. Individuals who provide care will cooperate and coordinate their work efforts fully with each other and with the individual. This provides for collaboration of healthcare. Recognizing safety and quality flaws in the current healthcare system has led patients to become vigilant advocates. Patient-centered care is a model where the patient is not only at the center of care, but is also a full member and partner of the collaborative healthcare team. Only the patient knows best when it comes to having an understanding of their own personal circumstances, their preferences, culture, and their bodies. Health professionals that are involved in informatics should seek input from the e-patients when developing information technology innovations. E-patients will lead the way in demanding that a healthcare system includes the patients as an integral part of the healthcare team. Participatory healthcare requires e-patients and the providers to use a variety of data sources to collaborate on shared goals and decision makings to improve health outcomes. The movement toward participation of patient-centered care requires that all systems align. Healthcare providers that are involved in informatics are positioned to participate in system changes that support the e-patient's desire for transparency to build a data collection to support their healthcare. The healthcare provider needs to be flexible and open to the possibility that patients are more adept at the experience of their own illness, and clinicians are not expected to have all of the answers. The aggregation or collection of data across similar experiences is also known as crowdsourcing. This is a useful pattern to recognize within the population and can also expand knowledge for public health. Crowdsourcing data from real patients in real time both expand and challenge how individuals view and study healthcare. Transparency of medical documentation is increasing and offers new and greater opportunities for the patient to engage. The internet keeps evolving and expanding to provide a dynamic and interactive web. Innovative environments continue to emerge in collective intelligence and knowledge of multiple stakeholders. This knowledge is gathered, exchanged, and shared. E-health is still considered a broad concept, and it's used to describe web-based activities related to healthcare. There is a digital divide that still exists in internet accessibility. The gap between the internet haves and have-nots is beginning to narrow, but it has not fully decreased. In the future, the e-patient is now considered the Google generation. This generation of computer users was born after 1993. These individuals have grown up with access immediately to information and knowledge